Is it ethical for the CDC to mandate vaccinations? So, in this case, smallpox is a highly contagious and deadly disease. Mandating vaccines prevents mass outbreaks. So, um, I have to think back to COVID 2020. Um, I work in healthcare, so for my healthcare system, they did, our employer did mandate us to get the COVID vaccine, unless there was religious reasons to not getting the vaccine. But they told us that if you don't get this vaccine, then we will let you go. So potentially losing your job because you know, the pandemic was serious. People were dying. Um, Outbreaks everywhere, all over the nation. So um, I would have to, agree with that and say that it is, an ethical thing. Had I not gotten the vaccine, who knows what have not happened, what would have happened to me, my family. The people that I'm exposed to. I am around different diseases every day, and I am very pro vaccine. So any vaccine that comes out that you know is going to potentially hurt myself or my family, um, then I'm going to proceed with getting it if it's going to mean that I protect myself and my family. So I would have to agree with that statement of mandating a vaccine. Um, Others might not say so or might not think so. To say that, I've heard it all. The flu vaccine, for instance. Um, People say that getting the flu vaccine gives you the flu. It does not. And I have to explain this daily to patients with the flu vaccine. The purpose for the flu vaccine, the purpose for any vaccine is a preventative. So, um, Intel to say that no, getting the flu vaccine does not give you the flu. It may cause you to have symptoms of the flu. You may become symptomatic and have flu-like symptoms getting the vaccine. Just depends on how your body fights those antibodies. But it does not give you the flu vaccine, the flu virus, I should say, the flu virus. It helps cut down that time of you being sick. So, say if I was to get the flu vaccine now and I started to have symptoms and I actually caught the flu, it would cut down that time. Me being sick for a week, maybe with the vaccine, it will cut down that time of me being sick for a week to maybe a few days. I would be less symptomatic of having chills, cough, fever, all the things that you have when you do have the virus. Um, but that is just a personal um, thing that I know for a fact, and working in healthcare for so long, and just and also knowing the different things that comes with vaccinations. So protecting vulnerable population outweighs individual preference and crisis. So yes, it is ethically justified. The duty, I feel like it was the hospital's duty to protect everyone that they could by mandating that vaccine for the smallpox. Going back to the case, um, because no one wants that. No one wants to be sick. So having something that will help you, it won't prevent you from getting the virus, but it can help protect your body. So, um, question number two. Um, Women in Los Angeles refuses the vaccine for religious reasons, but mandate requires vaccine for quarantine. Is it ethical? So respecting the religious freedom is important. You know, you don't want to undermine someone's religion and how they see things in life. It is what it is. You can't make someone do something. Um, you can only suggest and hope that they understand. And you know, if they don't, you know, they have options. Everyone has choice. So I feel that it's your choice to get a vaccine. Me personally, I'm gonna get a vaccine just because I know the science and everything behind it, and what it can do for you, what how it can help your body. Um, so, um, you know, I do feel like respecting people's religious beliefs is important, but exposing others to smallpox, that's you know kind of like a direct harm. So, um, again, non-vaccinators. Um, they choose not to vaccine themselves, their children. That's what they believe. That's that's them. But you're harming others. You're potentially, you know, harming others, and it could result into, death. So, um, I feel that I used to work in pediatrics. I worked in pediatrics for 7 years, and we've had some parents that would come in and bring their children, and they would do a alternate vaccine schedule or not vaccinate their children at all. And in turn, they were dismissed just because our providers didn't believe in that. They was open to the idea of, okay, maybe the alternate schedule parents, they were open. They were like, okay, at least you are vaccinating your child. No, and they may not have wanted them to get all of the required ones at the same time, or whatever age group they were in, but at least they were vaccinating. But the parents that didn't want to vaccinate at all, they were, unfortunately dismissed. Um, but it is to protect the ones that do vaccinate. And I wasn't opposed to that. Honestly, I was grateful because it can be like I said before, an indirect harm or direct harm, not indirect, sorry, a direct harm to others if you don't vaccinate your children. Um, Others may think otherwise. Like I said, everyone has choice. Bottom line, but I do wholeheartedly believe that vaccinating um, is a thing, and I hold true to that. My children will be vaccinated, so when I do have children, um, you know, so obviously I do um, believe in that. Um, Quarantining others um, while still preventing harm, that was an ethical compromise. Forcing the vaccination is ethically questionable, but quarantine is ethically justifying. So, keeping her that woman separate from the others that didn't want to vaccinate. Okay, um, I'm glad that that they came to that compromise. Um, because she could have just been, willy nilly, just out, just trying to spread, and that's not okay. So, for diseases like measles, is religious personal refusal ethical? It's uh, Measles requires 95% coverage, and refusing undermines the community protection. There's been a recent measles outbreak, in Kentucky, and just going by what the CDC guidelines. I work in urgent care currently, so we did have, not my clinic specifically, but we did have a measles outbreak in one of our sister clinics, and that was, that was pretty, we have protocols and, things that we have to go through to care for those patients. We're absolutely going to care for those patients. But we don't have measles vaccines on hand and in urgent care. So we did have to like run to our pediatric office that does carry measles, the MMR vaccine, the measles, mumps, rubella. So um, it was scary. And it's, it was a patient that came from another country and presented with symptoms. At first, of course, checking in, our staff thought that it was probably flu or something like that. But of course, we have certain indicators of distress. We have certain indicators that our front office has to go by, and luckily, we have really great and trained staff. So they immediately was questionable, and was like, this could be measles. So um, we were able to quarantine the patient and do what we needed to do. In turn, we were able to, like I said, borrow a MMR vaccine and vaccinate that patient and their family as well, because they hadn't had the measles vaccine at all. So um, the refusal increases risk to infants. So is very, 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 life-threatening to infants if they catch any disease, let alone measles, because they are immunocompromised. They don't have, fresh out, baby has, at least by 1 month old, they have a hepatitis B vaccine. They don't have anything else until they are 2 months old, and then so on and so forth, 2, 4, 6 months old. But they aren't they're not vaccinated, and they're not protected. So their bodies are innocent. So, and a pregnant woman who cannot be vaccinated, that isn't an ethical thing. So to allow the refusal when it endangers others, individual rights stop where they cause harm. Let's see. Question 4: is it ethical for individuals to refuse vaccinations? Yeah. I mean, it's not. Um, it's not wanted, but can they refuse? Yeah, it's their choice. It's their right. They don't have to get a vaccine. Um, People have the right to make the decisions about their body. Fully support that, and I understand that. Um, but refusing in a pandemic risks the lives of others. Again, going back to COVID, people that didn't get the COVID vaccine, um, you know, thousands and probably more than that, people died because the vaccine did not roll out. And but those people, they some um, had underlying health issues, and the virus attacking their body in turn um, caused them to die. People that didn't get vaccinated, are they living? Probably so. And they will say, "Oh, because I didn't inject myself with that stuff because we didn't know what it was. It was made so quickly." Um, I mean, yeah, it was all in the news, all the time. Every time I turn on the news, it was something during the pandemic. But um, refusing in a pandemic risks the lives of others. Yes, it does. Refusal may be ethical for the self, but not when it imposes harm on others. Um, I believe that wholeheartedly. You refusing, yes, it can cause harm to others, and Um, you know, how, you ask yourself, how can you care about someone if you don't consider them? How do you love people? How do you care about people when you don't consider them? My husband, for example, did not want the COVID vaccine. He's very careful about what he puts into his body. He doesn't even take Tylenol if he has a headache because he's like, no, I can find something naturally to get rid of my headache, or I'll just let it go away on its own. Me, if I got a headache, I'm gonna take some Tylenol. I'm gonna, I don't want anything to prolong my pain. So, of course, I don't just pop it just because. But like, if my headache gets bad enough, I'm gonna take some Tylenol. I'm gonna help something. I'm gonna take something to help, get rid of it. So, um, but when I broke down to him COVID, and told him, he seen me coming home every day. I would strip at the door and, take my scrubs off, you know, right, go right in the shower. I did not want him touching me. I didn't want him near me because I'm like, I don't know what germs, what anything is on me. And I don't want you, I would feel terrible if you had gotten COVID and something happened, something bad like death happened to you. If I could have prevented that, I'm gonna do it. So, when I broke down to him about the importance of getting a vaccine and how it can help protect him, he was on board. Um, I didn't force him. I just kind of, explained to him, like, hey, I work around this every day. And even now, like, even though the pandemic is over, COVID is still around and other diseases. So I'm always careful. I'm always at the door, taking my scrubs off, going right in the shower before I even greet him and say hello and give him a hug, immediately in the shower, because if I can prevent you getting something, I will. And, so just explaining the importance of, getting the COVID vaccine as well as any vaccine. Um, and he gets it, so he's on board about, um, just protecting us and our family. So, um, question 5. This one says 5 days COVID. Okay, so the fair distribution of the vaccine. Resources must be allocated fairly. Priority goes to high risk and most exposed individuals. So, um, I think me putting everything back to COVID is, reasonable, because it happened not too long ago. So, um, when the COVID vaccine rolled out, they were, administering to those high risk people, people with underlying health issues, heart disease, you name it. But people that were immunocompromised. So, and especially elderly people, I think they were, especially for my employer, my healthcare organization, they wanted, before they let, because I work in a outpatient clinic, before they let us even get the vaccine, they were first administering to people that worked in the hospital, because there was people going to the ER, getting admitted, into the hospital for COVID. So, um, in turn, they let those workers, those frontline people, get the vaccine first, just because they were more at risk. Not to say that we were less at risk, but people were going to the hospitals every day, sick, and wanting help, not knowing that they had COVID, end up being tested and had COVID, had to be quarantined, So those workers, they were literally around it every day. We were around it too, excuse me, but not as bad as the hospital. Um, um, if decisions were if decisions are transparent and based on public health need, resource triage is ethical, justifiable. So, making a executive decision like that to, distribute to those high risk people, or most exposed individuals first. I do feel like that is, that's a judgment call. That's something that has to be put into play, but in turn is helping. Um, Hopefully, there wasn't a shortage, but um, I think distributing like that is ethical. Um, Citizens demand mandatory quarantine for people exposed. Quarantine protects the wider population. So just like, during COVID, if you had symptoms, you had to quarantine, um, because there really wasn't before Paxlovid came out. Um, that's how people were just getting over the virus itself, treating the symptoms. If you had fever, cough, congestion, taking that Tylenol, taking those medications to relieve those symptoms, but staying away from everybody else so that you're not re-exposing and exposing others. So quarantining is a ethical reason to limit exposure for a disease. It must be applied fairly without discrimination, provided quarantine individuals are treated humanely with medical care and support. So, just like I said, treating those symptoms, getting the care that you need, but in turn, staying away from everyone so that you can get better, so that your body can, recuperate and get those antibodies back in, and also get in the vaccine to, you know, help the prevention of it. Smallpox vaccine can transmit virus to others, ethical to administer even unwillingly. So um, the risk of harming others through secondary transmission. Um, the benefits outweigh risk of uncontrolled smallpox would kill millions. People are fully informed, monitored, and precautions minimize the spread. Should healthcare workers be mandated to get the smallpox vaccine? I feel like that is a duty of care. I feel like yes, it should be mandated. Um, just like I said before with my employer, they made that call. They said, hey, if you don't get this COVID vaccine, you're going to lose your job. Did people leave? Did people think that that was crazy? And we had probably like a couple hundred nurses quit, just because they didn't feel like that was right. They were having their rights taken away from them. I can see that, but also we have a duty. We signed up for this, and the fact that we're exposed to hundreds, millions of diseases daily, why would you not want to protect yourself and protect your family? All I gotta do is get a shot. Okay, I'm not. That's not worth losing my job. I'm sorry. I'm not losing money for a shot. So of course I took it. Of course I did it to protect my family. Um, I'm very, spiritual, and I believe in God. So, you know, if God wanted to take me for, you know, getting a vaccine, if that was going to kill me, if that's how God wanted me to go, then it is what it is. That's how he wanted me to go, and I will be going to a far better place than here. But um, that's me. Everyone else didn't see it the same. Like I said, we had hundreds of nurses quit because they felt like their rights were being taken away from them. They felt like they didn't need to get a vaccine, and losing their job. That's not what they signed up for. Hey, that wasn't me. I gladly took it because if it meant protecting myself and my family, and I still get to keep my job, then so be it. Healthcare professionals have a moral and professional obligation to protect patients. That we do. It protects vulnerable patients and prevents hospital outbreaks. That is, ethically mandated. The duty to protect outweighs personal preference in healthcare settings. That speaks for itself. Um, we have a duty to protect our patients. That literal oath um, is, in our mission, vision, and values at my employer. So, um, I vowed to take care of patients and to take care of myself. So that means getting a vaccine that's going to help prevent spread of a disease. I'll do it. Should non-healthcare citizens be mandated? Um, Mandating for everyone is extreme, but may be necessary for highly lethal diseases like smallpox. So, okay, mandating that for non-healthcare workers like smallpox. I've never had smallpox. I don't even think I had chicken. Well, I did have chickenpox when I was a baby, but my mom and my aunt they had a chickenpox party for me and my cousins. So when my cousins got the chickenpox, my mom took me and my brother over there, and we got exposed, and we were all sick together because they were like, okay, they got it. Okay, they're gonna get it too eventually, so let's knock it out. Is that ethical now? No. But back in the 90s, that's they did things differently back then. So would I do that now? No. I'm gonna do whatever it takes to protect my child. But uh, yeah, that was what was done back then. Um, so, and I don't think they had a chickenpox vaccine back then. Or my mom probably didn't know about it. To be honest, I don't know. But um, do I think it's necessary to mandate it for non-hospital workers or non-healthcare citizens? Um, it's a choice. Mandating it for them, I don't know. I would honestly say that it's their choice to get that vaccine or not. Would I love for them to get it? Yes, if I was in this situation, this scenario, yes, I would want them to get it. Just because if they're going to be around others, then they need to be protected. Um, Mandate in high-risk zones, voluntary elsewhere with strong education. Conditional, yes. In true public health emergencies, universal mandates are ethically justified. So, um, in certain areas, certain zones, um, yeah, the education of it would be um, given for it, the reason why. So, so to close this out, um, public health ethics often requires limiting personal autonomy to prevent catastrophic harm. Principles in justice beneficence and the harm principle all support strong measures like mandatory vaccination, quarantine, and healthcare worker requirements, especially for diseases as deadly as smallpox. The ethical challenge is ensuring fairness, transparency, and respect for human dignity, even when individual freedoms must be limited. So, with that being said, everyone has choice. Everyone has a decision that they can choose for themselves. Um, it's challenging to get others to vaccinate, especially if you tell them that it's for a deadly disease like smallpox, but or like COVID to relate to that. Um, but it's a respect thing. It's a religious thing. People will say, um, you know, anything. It goes back to, you know, even politics. So um, everyone has choice at the end of the day. But as for me, I would get the vaccine if I was in this situation. I'll be like, yeah, give it to me because I don't want it, and I don't want to harm my family or others that I come in contact with. Thank you, and I hope this video uh, does well and gives us justice for it. Thank you.